Hello and namaskar to my Women Lift Health Cohort 2024 coaches, peers, colleagues, members, my supervisors, family who have joined here today. Before I start sharing about my leadership journey, a little bit about who I am. I'm currently leading the UNICEF West Bengal Health Portfolio. I'm reporting to the Chief of Field Office and aligning with various cross-sectoral team members within and outside with various cross-sectoral departments. I also lead multiple teams, smaller teams like program associates, program officers, and consultants. I bring along with myself 24 years of public health experience in community medicine and in various states of the country. I am a passionate advocate of women and child rights. You can call me a rebel with a cause. My project on Women Lift leadership was to support the Department of Health for strategic planning to strengthen primary health care systems to reduce maternal newborn mortality and teenage pregnancies. Now, this rationale fits very well with the UNICEF mission and vision. And our role is to actually support the state governments for reduction of maternal newborn mortality and strengthen climate resilient, gender responsive health systems to reach every mother, every newborn, everywhere. So when I looked at the West Bengal data, it actually showed me promising decline in the newborn mortality indicator at 14 per thousand live births. But if you look at the maternal mortality ratio, it had actually risen above the national average to 103 per 100,000 live births in the last SRS. So this problem required an at-scale approach. The idea that I was toying with was that if I look at data reviews across multiple sources of evaluated and reported data, I could then identify cause and burden and then create platforms for leading state and district level multi-stakeholder consultations, develop a digital template for gap analysis based on health system pillars, thus enabling the district and block officials to do their own evidence-based costed action plans, including the social behavior change action plans. And these would be reviewed at the highest office across the state and districts, eventually leading to an accelerated decline and action for the SDG goals. The data itself showed that the mothers who were dying, had died at the facility. 18% were teenage mothers, young primees, and most of them had not received the first PMSMA clinic for the high-risk pregnancy management. 56% had got cesarean deliveries. Pregnancy-induced hypertension, postpartum hemorrhage, sepsis happened to be the commonest causes. Of course, with district inequities. If you look at the NFHS itself, the anemia, low consumption of IFA, education being the reason for dropping out of services, poor access to antenatal, postnatal services, teenage pregnancies, and also JSY scheme poor access had education as one of the underlying causes. Supportive supervision visits also shared the data that skills, quality, and maintenance gap were one of the areas. And C-sections were high across public and private sector. So the progress so far, I have been able to have state level and 27 district level action planning meetings. I have been able to build capacity of the district and block officials to use their own data for costed action planning. We could also ally with the experts, academia, professional bodies, and amplify cross-sectoral voices, harness political will, engage with the technocrats and bureaucrats, and also develop costed social behavior change campaigns for the teenage pregnancy prevention and operationalize the midwifery care units. Where do I see myself going from here? This is just the beginning where I've started catalyzing, convening, and converging for enabling health system reforms. And from the costed action plans, we'll be focusing on the goals of skill building of health workers, scaling up midwifery cadre, focusing on investment in quality improvement cycles, specifically the audits for C-sections and the causes that we saw in the previous slide. WASH being at the center of sepsis prevention and maternal nutrition being at the center. Digital health innovations, specifically for supportive supervision, high-risk mother tracking, and learning chatbots. And also looking at state task forces for adolescent and health and teenage pregnancy and urban inequities. We are also looking at envisaging the CSO alliances, but public-private donors, and also upcoming World Bank programs for leveraging the funds for innovations. HRH studies, PHC costing studies are also being planned in the states to promote convergence. So whatever I learned, I think this has been one of the most authentic work that I've been able to do with data at the center, women and children and adolescents at the center from the most hard to reach blocks, cross-sectoral convergent action planning, which is strategic and impactful because it will be at scale. What I've learned in the journey is the male allyship, because when I joined the office, there were changing leaders inside the office. Externally, there were highest level officers were the technocrats and bureaucrats, and the environment outside was also very challenging with doctor strikes and the health system being burdened. During this crisis, I could manage to coach, mentor teams, and create win-win solutions to manage conflict, understand my own influencer style, and it called for me to also tap on my compassionate side as a leader, which all fell very well into the UNICEF, aligning with the UNICEF core values of 3 TAs: care, respect, integrity, trust, accountability, and sustainability. I think I have been from, now being reborn as a more compassionate leader, understanding my own influencer style. And this will also lead me to now lead the West Bengal office's action plan for staff well-being, empowerment, and psychological safety. I want to thank each of my coaches, mentors, colleagues, and cohort peers who have inspired me with their stories, my own supervisors, and my spouse who has continuously stood behind me, my family. And I want to dedicate this presentation to my colleague Pankaj, who I lost this year. He was an advocate and champion for women's rights, women leaders, and WASH in health. I want to leave this meeting with a quote from Emily Dixon: "If I can stop one heart from breaking, if I shall not live in vain. If I can ease one life the aching, or cool one pain, I shall not live in vain. Live in vain." I have miles to go before I sleep. This is just the beginning of my journey. Thank you so much.